Okay, about Dr. Tasneem, Dr. Tasneem is a friend of Dr. T. So basically, Dr. T was saying like Dr. Tasneem is she wants to like join our workshop, right? So she called me, or I called her maybe after a Zumba prayer, and we talked about something like how she can go for the study and all that stuff. But during her preparation, she was like so busy with her, like, for her motherhood and everything. So she couldn't do that much thing, but she joined into the workshop. She was there for 4 days. She was learning everything. And also, I think she was practicing with Dr. T as well, like for a few days, right? So, and
Yes.
she was there in KL. And after that, when I saw her result, I became so happy because she was a warrior. So now, Dr. Tasnim, can you please share your experience with us?
Yes, thank you so much, Atik Bhai. I'm very pleased to be here and honored. Uh, I think my result was very unexpected. As you already know, my child just turned 1 year after my exam. So I decided to give the exam when he was just 4 months old. And also, my job was starting, which was a full time hectic job. So my schedule was that I used to go to my job at 7 and I used to come home at 5. Then I would, in the middle, I had 1 hour break, and during which time I would come home. Then in the evening, I would come home again and give some time to my child for 2 hours. Then I study for 2 hours, something like that. Obviously, it did not work every day like this. I used to study with Dr. T at that time, and things were not going very well. So, but the important part is I used to see 1 or 2 pages every day, like whatever I have studied, whatever it is, like maybe 1 or 2 pages every day. I think that helped a lot. I thought that I was not going anywhere with my studies, but I think I did after my results came out. um, Surprisingly, I did not attend any mocks. I'm not encouraging anyone to do that, but then the thing is I did not have time for that. What I told myself was that even in my medical years, I was alone. I used to study alone. So, and during my prof, I delivered. So that was my thing. That is what I was thinking. That if I can deliver at that time, then maybe I will be able to do so even this time. And of course, I did not have time for mocks. I was very focused on finishing my syllabus at first, and then I joined the workshop. Before the workshop, I did not study anything, nothing from the skills part. After the workshop, I started doing practicing the examination and the communication and the skills. And thank you, Esra, so much for giving a very brief demo on the history, how to take it, and that was it. That was the only thing that I learned about the history taking. After that, my history was, there was a case about tonsil, right, Atik Bhai? I think we
Yes.
had this, yeah. So I did not read that at all. But what I did was I was thinking what are the questions I should be asking for this type of cases, and I just went with it. I think another thing that helped me was that I was on a full-time hectic job, but the thing is, even in during my job, I used to talk to patients in the same way that I would do in the examination, like how to counsel them, how to be more empathetic towards them. So in my job place, I used to practice that, and I think that helped a lot during my communication. Like while I was talking to them, I think my emotions were carried to the examiners. Otherwise, I do not think I would be able to pass it. For the knowledge sections, I went through the videos. I don't think I could go through all of them, but I went through videos as much as I can and went through the books as much as I can, and just went through everything. It's not that I only went through with the high yields. My motto from before was that I even if I can answer a little bit from everything, I'm okay. So that's the thing. Like I did not went through only with the high yields and the things that were coming, because I always told myself like for me, I do not know which station is going to come for me. So I have to know a little bit of everything. So even if a tough station come, I can at least answer something. And I also focused on the concept. I do not read anything blindly. If I try to read something, I try to go through the basics first, so that even if I don't remember everything, I can answer at least a few things from there. So So with my little child, so after I went there, uh, he was at home alone without me for 4 days. I went there and I was very tired, and I just went through some of the examinations. My partner was over the my husband was not over there as well. My friend was there, and we were very tired and was sleeping a lot. We discussed a few things, then I slept, then we discussed, and then I went to the exam. I was in full confidence that maybe I would not pass. But during the exam, I was very cool. I was not confident, but I was very cool. I was very calm, and I think in all the stations I was very smiling, and I was not tensed at all. I think that attitude of being very calm and professional helped a lot also to get the pass marks, because my preparation was very not up to the mark according to me. I was very underprepared for MRCS part A. If I have prepared like 80%, for part B I would like be around 30%. But I think it's all about communication, how you present yourself, how you talk to the examiners, and how you deliver. It's more about than that what you have learned in the last few days. I think that is it.
Yes, exactly. So
It was a
I
very tough journey. I think another thing
yes,
that helped me is I think my little boy prayed for me.
yes,
Otherwise, this was just impossible.
yes. So I will dedicate this video for, like, for all the mothers who will be out there thinking how I'm going to overcome this. All right. So very nice.
Yeah.
Excellent job you did. And I'm actually very happy, like just thinking of your situation, how you have come back and like how did you pass this exam. It's very, very amazing, amazingly done. Okay. So anyone wants to
Thank you,
ask?
Paham.
Yes, you're most welcome. All right. Anyone wants to ask anything? Or Dr. T, you want to say something to your friend?
She was there. She was there for me like a while. She was like, "You can do it. Don't
Hmm.
worry. You can do it. Keep on studying." She was always there for me.
Right.
Yeah, I knew that she would nail it, so no comments at the moment. I knew she would nail it, so yeah.
Okay. Anyone wants to ask anything to Dr. Tasneem about anything? I hope she will be
Yeah,
happy to give you
I want
answer.
to mention one thing, Dr. Atikba, if you don't mind.
Mm-hmm.
Tasneem Apuk, huge and hearty congratulations to you and your baby boy. Definitely,
Thank
because
you so
I'm
much.
more proud of your success compared to my success, because you have a lot of odds stacked against you, right? Right.
Yeah.
But still you made it, and you are supposed to be the ideal inspiration for all the candidates, that despite it all you still made it. And your words really mean something. So you were, although you said that you were not confident, but your approach was right. You were cool, you were calm, you were composed, you had a smiley face, right? And also I hope all of you can identify one thing. Dr. Tasneem is an excellent communicator. She can speak very concisely, and her words are very clear, and these are the things that you need to pass your exam. So congratulations, Apo, once more.
Thank you so much. You helped me a lot. I will never forget that history demo.
It was my pleasure and my privilege.
All
Thank
right.
you so much.
Thank you, Dr. Tasneem. And I will be hoping you'll be like, helping all the candidates, whoever needs any. Okay, just feel free to help all of the candidates, whoever ask anything, okay, into the group
Yes,
or
I'll be very glad
wherever.
to answer if anyone
Yeah.
has any questions.
Yes, yes.
But
All right.
never
Mm-hmm.
never break down. Everyone will be able to pass
Correct.
if
Yes.
you just be confident and smiling, and don't
Correct.
get too stressed about the exam.
Correct. All right. Thank you. Thank you, Dr. Tasneem.
Thank you.
Good luck for your future. All right. See you soon. Very soon.